I'm going to talk about the clinical applications of SKY. This is the iconic cover image from Pink Floyd's famous album, The Dark Side of the Moon. And this is the iconic picture of our presentation, The Light Side of the Sky. In this lecture, I will discuss the advantages of the SKY system for the documentation of ocular tumors, surgical retinal diseases such as diabetic retinopathy and retinal detachment, as well as macular disorders associated with concomitant peripheral retinal changes. To make the presentation more dynamic and easier to follow, the content will be divided into short modules, focused on different clinical applications. It's important to mention that SKY is a whole-eye imaging platform. However, in this presentation, we will focus specifically on its capabilities for wide-field retinal documentation. Let's begin with the choroidal nevus module. This is a beautiful true color image obtained with the SKY system, showing a choroidal nevus incidentally identified in the nasal periphery of a 48-year-old woman. The multicolor and true color images can nicely document peripheral choroidal nevus and may contribute significantly to the longitudinal follow-up of these lesions, helping the ocular oncologist during patient monitoring. In addition to true color and multicolor imaging, the SKY platform also provides advanced reflectance analysis using blue, green, red, and infrared wavelengths. In the future, it will be very interesting to further investigate the characteristics of choroidal nevi and evaluate how these lesions behave over time across different multimodal reflectance imaging modalities. Look how drusen are evidenced in these blue and green reflectances pictures, and how the choroidal lesion in this case was highlighted in red and infrared reflectances pictures. This projection highlights the contribution of blue and green autofluorescence for monitoring choroidal lesions. They are very useful for the detection of lipofuscin, one of the criteria used for malignant transformation of choroidal nevus. In this case, however, there is only mild hyperautofluorescence on both images related to the presence of drusen, without significant hyperautofluorescence suggestive of lipofuscin. And here you can appreciate that in addition to a beautiful wide-field color fundus image, the system also provides a wide-field B-scan that very nicely captures the choroidal nevus and clearly documents the drusen overlying the lesion. The Optos device may also document peripheral choroidal lesions using wide-field color fundus photography. The Optos Silverstone system also provides multimodal imaging with different wavelength analysis, ranging from blue autofluorescence to red and infrared imaging. One limitation of the Optos system, however, is related to imaging the peripheral retina with the B-scan. As you can see in the lower right image, there are scan deflections that impair a comprehensive evaluation of the lesion anatomy. Here's a comparison between the B-scan obtained with the SKY system and the B-scan from the Optos Silverstone device. In addition to providing a longer scan length, the SKY OCT allows a more comprehensive and integrated visualization of the lesion in relation to the overlying retina, the adjacent retina, and the surrounding posterior pole anatomy. These relationships are much more clearly appreciated on the SKY B-scan. In contrast, the Silverstone B-scan demonstrates image deflection, making it more difficult to analyze the fine anatomical details of the retina adjacent to the lesion. And again, at higher magnification, we can appreciate that the SKY-B scan maintains excellent image definition. Even with increased magnification, the SKY OCT preserves the anatomical details of both the retina and the choroid, allowing a more precise evaluation when compared with the Silverstone B scan. This was the choroidal nevus module. If you have any doubt, please do not hesitate to contact me using WhatsApp or email. Thank you.